My name is Jamie Lee Twist Schroeder. I'm somewhat recent, I guess, still compared to 25 years ago. I had my surgery in 2018, so 3 years ago now. I'm actually a native of San Francisco. Not native, I shouldn't say. I'm a resident of San Francisco. I'm coming from this video now in San Francisco. I live in the Presidio. But I first came to the Bay Area as an undergraduate at Stanford. And then I was in medical training for 12 years after I graduated. And during that time I transitioned and I came back out to do fellowship in San Francisco and to come back to Stanford again. And so that's where I am now. And let's see, I have 3 kids with a 4th on the way. And my transition my surgery was about 2 years into my transition.
And as a medical professional, I think you have a very interesting insight that would be great to share with people. But before we get into some of the technical stuff, I just wondered if you could talk a little bit about what concerns you regarding your face and why you decided to prioritize facial feminization.
Well, I think that my transition would have been very different without FFS. I think that I have a lot of signals that would tend to skew masculine, mostly being my size. I'm very tall, and I'm also pretty muscular. And of course, neither of those things are completely a bimodal distribution for gender, but they tend to skew very heavily, and people tend to gender without seeing, even without seeing my face, they would guess gender as male just because I'm so big. I'm almost 7 feet tall. And so I think that I prioritized FFS partly because I had my own difficulty seeing my own face and seeing my own gender as authentic when I didn't recognize myself in the mirror. And I also didn't have the social mirroring if I was constantly getting misgendered and or people assumed that I was cross-dressing or something, that just like my authentic gender wouldn't come through because people's implicit gender recognition machinery of their brain was just not working with the appearance that I had before. So
yeah, I always feel like society is the mirror that reflects back. And if you look at yourself in the mirror and are happy just one-on-one, that's one thing. But when you're not getting cues back from the public, that can be very difficult and stressful. So,
and it was both for me. So.
Yeah. Yeah. And, I'm very tall as well and have very broad shoulders. And I realized early on that you can't change the things that you can't change, and you should focus on the things you can, which is why I thought facial feminization was so important, and it turned out I was right. So when you were researching, can you tell me a little bit about the process that you went through, like how many people you were looking at, how you made that decision?
Sure. I had friends who were trans women who had gone through FFS before, and so I started with their recommendations. I looked at Spiegel in Boston, and I had a consultation with him. He was my first consultation. A few months later, I consulted with the facial team from Spain. And then Deschamps-Braly was my 3rd consult, and I didn't need any more after that because I was, from the moment of meeting him, I was pretty convinced that this was the person to do my surgery.
And how would you compare the 3 consultations? Like, what was the difference between them?
I think there are 2 things that stuck out about the consultation for Deschamps-Braly. One is that it didn't seem like he was trying to sell me on something that was kind of very theoretical, like just saying, oh, you'll be so beautiful, and just kind of going on and on about how great it will be, rather than just talking some specifics about, this is how FFS works, this is my approach to FFS, these are the specific things. It was very much more scientifically focused as to, a recognition that FFS is really about altering the effects of testosterone-driven bone deposition, and with the explicit purpose of people's implicit gender recognition machinery of their brain and the way light falls on the face and everything else. And in that context, what were the types of procedures that could help change that appearance? And I don't know if he took that approach for everyone, but I was a scientist and a clinician myself, so that approach certainly resonated with me. And he clearly had a passion for both aspects of medicine, which I thought were so critical. One is the kind of scientific excellence of understanding how to do the absolute best result, which in his case is not only safety, but also ultimate appearance. And then the second of just really wanting to help people. I could tell that, he just had a great compassion for people and was, not trying to, kind of tell them sweet lies or something like that. He was just really compassionate, wanted to help you, saw the position you were in, and also had the expertise to do something about it.
You brought up something interesting that I think a lot of people really don't quite understand when they're looking, and that is the difference between beauty and gender presentation. And can you talk a little bit about what your experience has been with those differences?
Sure. I mean, I think that as far as feminine presentation, they unfortunately overlap, or fortunately, I'm not sure. I mean, they overlap because the less you have conventional beauty, the more you will, the more often you will have people's gender recognition machinery fail, because as a culture, we tend to dichotomize appearance purposefully. And people that need the least dichotomization are people that are considered kind of the isotype for beauty, or the archetype.
Right, the symmetry, the sort of certain things, as you said, with
whatever the
light
culture says, this is what's beautiful, are often the exact point to which people are trying to dichotomize themselves. There's an archetype of male beauty, an archetype of female beauty in a given culture, and people will try to intentionally dichotomize their appearance to match one of those two, regardless of what their underlying facial features are. There's not, a strictly, there's not a very large bimodal distribution in a lot of the things that we are trying to reverse with FFS. But at the same time, people do things to exaggerate them. And that's why females tend to wear more makeup in Western societies, because they're trying to emphasize that aspect of their appearance, the way the light is falling on their eyes, to emphasize their lack of an orbital ridge, for example. But I think the DP acknowledged that in his first consultation with me, and said there's some overlap, and some of the parts of the procedure that I would recommend might be more towards the conventional beauty standards, not strictly towards people's gender recognition machinery. And you can take them or leave them, because these are the things that I think will be most important for people to recognize you and your gender when they see you implicitly. And there's other things that will maybe improve your appearance as far as a conventional beauty standard, and was prepared to discuss them and the risks and costs of doing either approach.
Now, as far as the consultation that you had, can you sort of roughly give a timeline of when that happened in your transition and how long it was until surgery, so that people who are trying to plan this out might have some insights on how you went about it?
Sure. My transition wasn't entirely linear or conventional. I don't know if anyone is a conventional story. I had a non-binary phase, not publicly, but I started undertaking my own kind of gender-related surgery starting in 2013, but didn't really start, including testosterone lowering and other things, between 2013 and 2017. And then it wasn't until 2017 that I decided I was going to transition. And I told my extended family and my colleagues and whatnot, and began that process about a year before my surgery. And so I was out to a fair number of people. I was out to my family, and I was out at work, kind of. I was out to people that I was close to at work, but I can't say that I was dressing pretty androgynously at the time, just because I'd actually really feel very comfortable with the full femme presentation, just because it didn't feel authentic to me in some way. I didn't recognize myself. When I saw myself, I saw male and female clothing. And I had already done some of the internal work to deal with that. And of course, that doesn't go away entirely after you get any surgery. You have this kind of internalized feeling of yourself that just takes your own time to reprocess of what it means to be a real man, a real woman, a real whatever, however you describe your own gender. Right. And for me, that happened after I had FFS. So I was relatively early in my transition. I'd only been on estrogen for maybe 18 months. And I continued to have changes in the year after I had, a year or two after I had FFS.
And when did you go full time after FFS?
After my recovery from surgery, I didn't ever try to present male again.
So immediately after that, you went full time.
Yeah, I mean, I don't know what full-time really means. I was presenting androgynously for probably the 6 or 8 months leading up to it, and asking for female pronouns when the context was appropriate. But I wouldn't correct people when they misgendered me or when they used whatever pronoun on me during that time until I said, I felt more comfortable claiming my pronouns and telling people what they were when after FFS and after I started transitioning my wardrobe more towards kind of a more binary appearance of gender.
Yeah, it's probably a generational thing, because when I did it, it was like flipping a switch. It was like, I left, and when I came back, I would look very, very different. And I think at the time that helped people make that switch mentally. But it's interesting in your case that you sort of gradually did it. And I know a few other facial feminization patients who've done something similar. What was your experience after facial feminization with that sort of gradual? Where did that fit into your gradual acceptance?
I feel like I can't tell. I mean, I didn't go out and I had friends that tell me this was great and this is going to be so wonderful and it looks so different. But the real change came within me, and it was a little bit like flipping a switch. Like maybe not 100%, but after FFS, of course, your face looks a little bit off because you're swollen up, and things are not kind of settled back down the way they will, and it takes months for it to kind of like the face to kind of settle into what it's going to look like. But immediately, even within a week or two after the surgery, I could look in the mirror and I would almost double take, because my implicit gender recognition machinery of my own brain was telling me that I was a female in the mirror. And that has just like kind of an incalculable impact on how I felt about my own transition.
Yeah, it's wild how when you see yourself finally and don't feel like you see someone else, it completely changes how you feel about all of your interactions, not just internally, but externally.
Right, exactly.
So can you sort of take us through what your experiences were as far as from arriving to surgery and the recovery?
Sure. Well, it was a little easier for me since I lived in town already. I had the car come to my apartment and pick me up on the day of surgery. Well, I scheduled the surgery I think it was several months. I think I had my consultation in the spring or the summer and my surgery in October. And so it was, some number of months, but not too long from the time that I had my consultation to the time that I had my surgery date. So I think it was a cancellation. I think I got called up, maybe only a month or two before my surgery date and was offered this is one of the three possible dates that I could take. I could be either October or, January or March or something like that. I was like, oh, let's do this October one and make it work. So I kind of certainly prioritized that and got my workplace to cover me during that time and take the necessary steps for my training that I could kind of resume when I was recovering. The day of the surgery itself was pretty smooth. I mean, it's an early wake-up call, and arriving at the surgery center, I think I'd done a couple of appointments in the day or two leading up to the surgery, and maybe taken a day or two off work even before the surgery as well, and had gotten the scans and gotten, I think, one more appointment at the office. But the day of the surgery, you're up early, you talk to anesthesia, and then a quick consult from Dr. Deschamps-Braly and his team, and then it's go time. And I don't, the surgery's a very long surgery. I think it was something like a 6-hour surgery, and I don't remember any of it. I don't remember any of that day. I have a picture of me waking up that night and with the drain still on my face, and I don't remember that being taken out. And you get discharged the next day. And that's when my memories kind of pick up again, is being discharged and going to stay with a friend, actually.
And so what was the process like once you were discharged through the post-operative consultations in the office?
Post-op consultations in the office. I remember there being several in the first couple of weeks, and there were various kind of stages of removing some bandages and maybe removing some stitches, and increasing activity levels. But overall, it was really just, that seemed to be more like safety checks and not very much focus on appearance. Just, I guess certainly we debriefed afterwards, and he said, I think this was very successful. And, I think we really accomplished the goals that we'd set out when we had a consultation. But the appearance, I feel like it's kind of like a delayed reaction because, different from other surgeries where there's like, clearly binary change. It's kind of like, it's not quite as binary. I mean, these are relatively subtle things, and they're kind of lost within the post-surgical appearance. A lot of the subtlety that you have actually been working on changing, it wasn't that subtle in my case. And I think I had a centimeter taken off here, 11 millimeters taken off there. Like, those are actually pretty drastic changes. But the full effect of them really can be lost in just the post-surgical appearance. And it wasn't until probably at least 3 to 6 months later that I kind of was like, oh yeah, we actually did do a fabulous job. This is really amazing. So,
and as far as immediately afterwards, how would you describe your comfort level and sensation? Were there issues that you think people might need to be aware of in terms of
sure,
preparing?
Yeah, so my surgery both involved my forehead as well as my lower lip to get the jaw, and so both those areas had really substantial numbness and lack of even motor control for at least a couple of weeks as far as my lower lip was concerned. I had incomplete like lower lip motion and couldn't really speak properly for at least a couple of weeks, and then didn't have normal sensation for probably 6 to 12 months. It started to come back gradually. I could feel it, first of all, it was almost numb, and then it started getting a little bit of pain and tingling sensation, and that kind of progressed over the next few months until I started getting some strange, I remember just tapping on my head and just doing like these little patterns of figuring out where my sensation was coming back. And it's totally normal now in my forehead, and I actually still have residual, tingling sensation. There were the pain sensation and the pain and the sensory fibers are still a little bit crossed in the area where my scalp was moved a little bit. But I think my sensation for my face has essentially returned to baseline. But that would probably about 2 years total for a total return to baseline.
Yeah, and did you see any changes sort of appearance-wise after 6 months? Did it continue to settle, or was that sort of when you saw the bulk of it?
I know, I feel like it's still settling a little bit 3 years on. No, I probably not. I think that the bulk of it was in the first 6 months, but the year and a half after that was still probably some changes. It's hard to pick apart for me since I'd only had, a year and a half on hormones, what the next year and a half of hormones was doing to my face as well. And so I think that the surgery, it's kind of, I can't deconvolve those two signals of what was happening just from being on hormones for longer and what was the result of the kind of post-surgical evolution, the 12 to 24 months after the procedure.
So one question that a lot of people have is regarding financing and how that went about. So did you pay out of pocket? Did you have insurance? Can you sort of describe generally what happened there?
Sure. I paid predominantly out of pocket with the help of a relative who I was able to tell how important the surgery was to me and was willing to gift me the money. In fact, to help, to make up for what the difference was between my savings and the cost. And, that's an incredible gift and a privilege that obviously lots of people don't have available to them.
Were there any surprises or unexpected things that came from your results? Like, did you have an idea of what was going to happen that was different than what actually happened?
That's a good question. I wasn't really sure what to expect. I didn't expect it to be as impactful or as I don't know, as I wasn't sure what could happen. It seemed like it was just, I saw that it could almost be miraculous as far as how much it would change people's gender, kind of the way they were implicitly gendered. And I feel it was miraculous in my case. I'm not sure I was expecting a miracle to happen for me because I felt like, oh, well, everyone else gets it, but this, this felt like there's some probability this will work, but probably there's also a good probability it won't work. And I was willing to take that risk. And, at the same time, I wanted to have someone that had the best ability and, the skills and motivation to make it happen for me. And I think that I was lucky that I did. And it's no guarantee for anyone. Nothing in medicine is, but in the hands of, I think, someone has this, the pedigree of training from Osterhout and Deschamps-Braly is, you're giving yourself the best chance.
Yeah, that's one of the things that I always tell people just generally about transition is that it's a leap of faith and that you have to at some point let go of your fears, and I think especially with surgery, the best thing that you can do is do your homework, talk to as many people as you can, and try to uh, make the decision where you're not cutting corners. I feel like this is a very important investment because everybody sees your face every day. And it's one of those places where if you don't have the money on hand, I think it's almost worth taking the time to get the money to go to the person you want to.
Or getting the right job that'll cover it. Yeah, exactly.
Exactly, right. And so I've been really pushing towards people really thinking of it that way as something that, as important as top and bottom surgery is for a lot of people, sort of in the way that we talked about feeling different about yourself. Right. I think that because everybody sees your face every day now that we're not all wearing masks all the time in some parts of the world, it's really it makes such a big difference in how people respond to you. Absolutely. And
it was definitely the most impactful aspect of my transition, I feel like, to date.
Yeah.
That in hearing people, just because that's such a a dichotomous signal of gender in our culture.
Yeah. And as far as advice for other people in terms of getting facial feminization surgery and planning it and sort of where it fits into your transition, do you have any advice or suggestions for someone who might be at the beginning of their research and is trying to make a more informed decision?
That's a great question. I feel like everyone's situation is so different for where they are with their gender and their ideas of transition when they finally decide to get medical help. It's so variable. I mean, it's something that some people struggle with for decades. And you think on average in the generation of trans people thus far, it's something like 10 or 15 years from the time that you consider transitioning to the time that you actually legally transition. And that, I think, time interval is getting smaller as the costs associated with transition, from a societal cost and an interpersonal cost, as greater acceptance of being trans just increases in our society. Those costs, perceived costs, are getting less, and people, I think, are going sooner. But there's still a variable amount of time where I don't know, what sort of time people have taken. I think certainly, I agree with you, to get a lot of different opinions, to think about all the different forms of your surgery, of your, what medical and non-medical aspects of your transition are important to you, and to talk to people that have done this before, because I think that's when you have that sort of experience reflected back at you. So few people have gone through this, these had to struggle with these decisions, that it's just worth it to try to seek out people that have, and that are willing to, talk with you and listen to you and find your own situation and reflect back to you, knowing that the process and what it's like, to just be able to listen to you as you work your way through what you want.
Well, and that's why I'm so grateful that you're doing this and sharing your own experiences, because I know how important that was for me to talk to people who'd been through it before, and there weren't that many back then. So it's really great. One last question. So for people who haven't met him, how would you describe Dr. DB? Like what was your impression when you visited for the consultation, and what has been your impression of him in terms of his professionalism and all that?
He is exceptionally professional. I think that he has kind of two things that are a little bit dichotomous. One is he's so energetic, but he's also pretty cool. So those two things kind of interplay, I think, in an interesting way, where he kind of really will nerd out over like what's going on and what the different options are, as far as what can be done, and his practicing his craft of craniofacial surgery. But he's also just a very very cool, very well dressed, very knows the San Francisco scene, and has like the highest rent office space practically in the world, and it's just kind of his own scene. It's not exactly my scene, but it's a cool combination of things. He certainly, I think he's one of the most talented surgeons in the world, and he deserves, I mean, people can take their talents and use them to make themselves very wealthy. And I think that, he's gone for a very high end part of the practice, which I think is reasonable because a lot of he's in very high demand, and I can't fault him for going that way, but it is a very high end experience. Different than a lot of other medical care that both I have provided and gotten from in other contexts. That said, it is with those sort of resources that he devotes to each patient. He has very high levels of safety and very high levels of continuity of care that he can provide as part of his surgical experience, which I think ultimately, it's hard to put a price on your health. And I was more than happy to have someone that was crossing every single T and dotting every single I to make sure that everything was done just so.
Yeah, it's so important to feel confident in the person you go to and to feel like you're making the right choice. And I know from Dr. Osterhout that he was very focused on the results, but I think that Dr. DB has sort of taken it up a level in terms of service. And that's pretty interesting to dip into that world. It's not a world that I usually run around in either. So it's probably almost nice for some people to see that for just a little bit.
Sure. Yeah.
But do you have any last thoughts or comments regarding your experiences or why you would recommend taking the path that you did and choosing Dr. DB?
Well, I feel very lucky that I had the opportunity. I mean, so much of it is happenstance in your life, and I feel incredibly blessed that this was the path that I ended up finding. I would say that lots of people, or FFS, just the number of people that are offering it is increasing as there's greater demand and greater coverage for it. And but that doesn't mean that there's the requisite experience there everywhere. And I think that going to a practice like this, like essentially going to the root of the tree, where it is the most solid experience and case series over many, many decades of refinement of this procedure, and the procedure itself and the recovery from the procedure is just so important. And I think ultimately the results will attest to the benefit that you can get from having that degree of experience and focus.